Good morning and welcome everyone to our third Wednesday Parent Resource Chat. We're so grateful to have you here with us. These monthly webinars are part of Oak Hill Regional Community Development Corporation's mission to support Mississippi families with accessible health information, practical guidance, and a safe space to ask questions. I am Bettina Campbell, and I am the Social Service Coordinator and Certified CM Marketplace Navigator for Oak Hill Regional Community Development Corporation, which is the parent corporation for Healthy Together Mississippi. Joining us again today is Mr. Thomas Robertson, our Technology and Metrics Director. We recognize our Executive Director, Dr. Michael O. Miner, and our Program Director, Lottie Miner. Many of you are aware that each month we focus on a national health awareness topic. We invite presenters from Mississippi and across the nation to come on and to talk to us about what it means to our local communities. Our goal is always the same: clarity, connection, and resources that make real differences for parents and caregivers. Thank you for joining us. We are so excited by this opportunity to share, learn, and grow. We encourage you to share our Healthy Together Mississippi Facebook page and our website, www.healthytogetherms.org. And we want you to stay tuned because we always have something exciting coming for you. So, as we always talk about our national awareness days, our weekly awareness days, our daily awareness days, we just want to kind of help you to understand what's going on in the month so that you can participate in it and you can gather health information as you need. So in August, we feature numerous health awareness observances, and it was kind of hard for me to decide which ones to talk about because they are all so good and also relevant. But we're going to focus on our National Immunization Awareness Month, which promotes vaccinations for children, adolescents, and adults, and it emphasizes on catching up on schedules and preventive care. Psoriasis Action Month is another national month that focuses on improving research, treatment, and quality of life for individuals with psoriasis. There's Children Eye Health and Safety Month, and it encourages parents to protect their children's vision and to make sure that they schedule their eye exams so that their children are able to see properly. Their vision is, and then so they will do well in school. Then there's Summer Heart and Heat Safety, which focuses on preventing our health-related illnesses, especially with our seniors. And those athletes, our children start practicing again for football, and we want to make sure that we're giving them the correct information and making sure that they're drinking lots of fluids and staying hydrated while they're out there. There are also weekly observances that are worth mentioning. The World Breastfeeding Week, and it recognizes the contribution of health centers. It represents celebrating nationally from August the 1st through the 7th, and it promotes breastfeeding and maternal health. Then we have the National Health Centers Week, and for that we have our federally qualified health centers that are doing an awesome job in providing health for people who are low income or no income. But guess what? If you have excellent insurance, they also provide great health for you. And in fact, if you have good health insurance and that pays, and so it will also help them offset the cost of providing care for those who do not have good health insurance. So again, we want to recognize them, and that was August the 2nd through the 8th. And then there's National Promise to Care Day, and it encourages caregivers and community support. That was on August the 1st. Again, we often forget that there are people in our community that need our care and need our love and our support. So we want to celebrate that day again on August 1st. And then there's National Senior Citizens Day, and that's coming up. It's observed on August the 21st, and it highlights the health and wellness of seniors. And finally, then there's Relaxation Day, which was this past Saturday, August the 15th, promoting mental health and stress reduction. And unfortunately, nobody told me that in time for me to relax, because we had an awesome community-wide baby shower on the 15th, which took a lot of work. But now we're awfully glad. But remember, self-care is very important. So we want you to make sure that you're getting the rest and relaxation that you need. So now, have you ever wondered why we have so many health awareness days, and their weeks, their months, and why we take time to mention them here? It's because these observances shine a light on issues that often go unnoticed. They encourage conversations about conditions and affect millions. And sometimes these people are suffering in silence and we don't even know. So when we do something here, that it helps to increase their awareness, and it helps you to think about them and to reach out. And by dedicating the time specifically to these topics, we create a space for education, early detection, and honest dialogue. Our public health organizations and medical professions use these months to share accurate and up-to-date information about what's going on. And so we want to make sure that we are doing our job in providing this information for you. So now, because we do believe that when people know about information and they understand their options, that they will take the time to become healthier. We want to empower you with that through knowledge, because knowledge is truly powerful. And when we know better, we can do better. So today, along those lines, we have Dr. Jara Best Jones, and she's going to help us understand why it's so important that both adults and children stay up to date with their immunizations. So, but before we start our presentation, I want to again remind you and to encourage you to share this webinar. Then get your pencil and your paper so that you can write down any questions or concerns that you might have as we go through this presentation, because we will give Dr. Jones and you a time to have a discussion about those questions later on. So we want to make sure that you get everything that you need from this presentation. So again, let me just introduce you to this awesome lady, this very busy lady, and we really want to thank her for taking time out to come on the show and join us to provide the information that we need. So she is Dr. Jara Best Jones is a physician, and she's a pediatrician. She's a physician leader, and she's a community health advocate with more than 20 years of experience caring for children and families across the Mid-South. She's a graduate of Tennessee State, yay, and the University of Tennessee College of Medicine. She completed her pediatric residency at LeBron Children's Hospital, and she spent 2 decades providing compassionate family-centered, let me go back and say that so you can hear me, compassionate family-centered care through pediatric consultants and LeBron's Pediatricians. After retiring, you mean you actually took time to retire? After retiring from clinical practice in 2024, Dr. Best Jones continued her commitment to children's health by joining the Cumberland Pediatrics Foundation as the West Tennessee Regional Director. Yay! In this role, she works closely with physicians, schools, and community partners to strengthen healthcare access, support physician education, and advance public health initiatives that help families make informed, confidential health decisions. Informed, confident health decisions. Okay, so Dr. Best Jones is also a dedicated servant leader, if you think she can find time. She serves on the board of directors for the Women's Advocacy Center. She chairs the Memphis and Shelby County HPV Cancer Prevention Roundtable, and she is the president-elect of the Bluff City Medical Society. Her longstanding community service has earned her recognition and includes the Volunteer Mid-South Adult Volunteer of the Year Award. Known for her warm, practical approach, Dr. Best Jones has a gift for making complex medical topics easy for families to understand, whether caring for patients, monitoring future healthcare professionals, or speaking with community groups. She believes informed families, trusted providers, and strong community partnerships are essential. What's that? Informed families, trusted providers, and community partnerships are essential to build healthier communities for future generations. Again, welcome, Dr. Beth
Thank
Jones.
you. Thank you.
We are so excited to have you here with us this
I'm
morning.
excited to be here. Very excited.
Yeah, great. So, well, let's get into it, and we're going to start our discussion by asking questions about child immunizations. So, starting out, what are some key vaccinations children need before they start daycare or school?
Great. So, one of the best things, one of the best things parents and everybody can do for preparation for daycare or school is to making sure their children, their kids, elementary, adolescents, that they're all up to date on their routine childhood vaccines. So, the main ones that you need for daycare as well as school are your, we call it DTaP, which is your diphtheria, tetanus, and pertussis, also known as whooping cough. You need your polio vaccine. You need your hepatitis B vaccine that helps prevent a very contagious liver disease. So you need hepatitis. You also need MMR, which is your measles, mumps, and rubella. Varicella, also known as chickenpox. So you need your chickenpox vaccine. And if you're going into seventh grade, you also need your tetanus booster or your Tdap. And for the little ones going into a daycare or a Head Start kind of facility, they also need their what we call pneumococcal, which helps prevent those pneumonias and those dreaded ear infections. So they need that vaccine, as well as what we call Hib or Haemophilus influenza, which prevents a very bad pneumonia as well. So those are just the requirements that you usually see on that shop record when you register your kids for school. You go to the doctor, they give you that little shop record form that you need to have signed before you can go register, before they let you in the door sometimes. So those are the ones on that shop record that you'll see for daycare.
So those are
school. Mm-hmm.
wonderful. So that's a lot, but they need those, and they're really
Yeah,
protect themselves and
it just
others.
sounds
Yeah.
like a lot because the words are so big, but yeah, those are the main ones that you'll need to get into daycare and schools.
So why do childhood vaccines require multiple doses?
Well, the way I explain it, when you think of everybody has an immune system, right? So when you're born, your immune system is brand new. It's just getting out to the world. So what you do with your vaccines is you're teaching your immune system a new skill, if you think about it that way. So that very first vaccine, it just introduces your immune system to what it is that it's supposed to be fighting off, and then the rest of those vaccines that are spaced out for you, those later doses, they just kind of help reinforce that protection. So multiple doses doesn't mean that the vaccine isn't working. It's just kind of part of the general plan to make sure that you're getting the strongest and the best protection from your vaccine. So just because, people say, oh, that's too many, you're not getting as many as you think you are because it's such a small amount, but you're just reminding your immune system like, hey, this is what we're supposed to be fighting off in case, unfortunately, we come in contact with that disease. Your body's already recognized it before. We already have the stuff ready to fight it. And your other doses are just helping remind that immune system that we already know what this is to fight it.
So another way of saying it is that the initial doses are just kind of a jump start, a kick start.
Yeah, it's the introduction. What is this?
Introduction, okay.
And then the rest of them is kind of the reinforcement of that jump start.
Yes. Okay. Wonderful. Mm-hmm. So what should parents expect after child gets vaccinated? What's normal versus what's concerning?
Right. So one thing I always emphasize is that most children, if not many, most of everybody, they do really, really well with vaccines, other than your kindergarten coming in and not wanting them. But most children do really well with vaccines, and serious reactions are rare. So, of course, one of the main, it's very common to have a soreness, where you got the vaccine, so the soreness or redness where the vaccination was given. Sometimes kids will get a little bit of a low-grade fever, but that's a sign that your immune system is working, that it recognizes that something's foreign, like, what is this? And here's what my body's going to do to fight it. So kind of like when you get a cold, you feel kind of tired, you get a little bit of a fever, a little sleepy, that's your immune system revving up. And so the same thing happens when they're revving up when they get that vaccine. It's talking to your immune system like, hey, here's what this is. Let's go ahead and get ready to fight it. Or, of course, you have the opposite. Sometimes those babies get fussy because poked them and they're mad. So, but those are common reactions. Things parents need to look out for, like I said, it's common to have a little bit of a low-grade fever. If you get a high fever, when I say high fever, I mean 101, 102, that's lasting longer than 2 to 3 days and not coming down with the Tylenol that you can give after vaccines. Or if your child is extremely tired, difficult to arouse. Honestly, anything that's concerning to a parent after vaccines, I always encourage to call your doctor just to talk to them, and they can reassure you like, hey, that's common, let's try this. Or, hey, I think I might want you to bring them on in just so I can check them out to be sure. So anything that you're just not comfortable with, always make that call or pick them in if you need to. But it's like I said, it's really common to have those little bit of soreness. Sometimes I'll get what we call a shot knot or a little bump where the shot was given, because these kids are strong now. They'll fight you.
Right.
So,
Right.
so just sometimes they'll get a little knot, but those are common too, and even a little warm compress there. But
Oh, I'm
any
laughing because when you said these kids will fight you, it reminded me
man,
of a flashback to my daughter, how the
uh,
nurses had to wrestle her.
like like WWF sometimes. And these kids are strong.
Yeah, and sometimes I understand it because I'm not crazy about needles
Exactly.
myself.
Yeah,
And
there's no
so how do pediatricians support families who feel nervous or unsure about vaccines?
one thing I always remind them, and that is listening. First of all, I listen. After over 20 years of caring for children and families, I know that when parents are asking questions about vaccines or about anything, asking about vaccines, they're really just trying to get more information because they're wanting to protect their children. So the first thing I do is I listen, and I want to know what they're concerned about. Tell me what it is that you're really concerned about. Is it something you heard or saw online or heard from a family or even from personal experience? What is it that you're actually concerned about, so we can talk through those concerns and address what your issue might be, and using reliable information. Like I said, we're getting a lot of information from everywhere. So I want to make sure as I'm listening that you're having the correct information so they can make those very important decisions, and I can help them make that decision as well. So developing that trust with your families. Now, I call all kids, no matter their age, I call them babies. I know some kids are bigger, but I just think of them as my babies. So I always want to make sure that parents feel comfortable asking me anything about their babies, because it's their responsibility to, number one, take care of them, make sure they're safe, and protect their health. So if they're developing any concerns or their issues about, why are we doing this one, and explaining everything that we're doing is also very important to help anybody who's unsure or nervous about getting vaccines.
Oh, it's wonderful. It's
Mhm.
important that parents understand that they can talk to their
Yes.
doctors, and
Don't
not only can, but they actually have a responsibility
I was
to
about
talk
to
to their
say, put the
doctors so
words
that
out
they are
my
making sure that their little ones, or as you said, their babies, because I call them babies too,
Yeah, I know.
are
I'm
are
saying
are getting the appropriate care. And so,
absolutely.
and we hear so much out there,
Yeah.
with the social media.
It's
It
so
sometimes it just goes crazy, and
it does.
especially right now in today's
Mhm.
age. So we want to kind of talk about what are some of the myths that we hear that are just absolutely not true.
Well, my goodness, there's so many. Sometimes, like you said, there's so much that comes across on social media. Sometimes I just stare and blink my eyes like, how did you even think of that? But I got to understand, we're in a different world this time. But of course, some of the most common myths that we hear, one that we're hearing now is that we're receiving too many vaccines, right? And their vaccines are overwhelming their immune system. But in reality, if you think about it, a child who is in daycare or preschool or definitely in school, um, they're getting exposed to all kinds of stuff every day, all day from their little friends. We see those little kids in daycare wiping their nose and grabbing each other. They're constantly getting exposed to bacteria and viruses every day, which is a lot more than what they get exposed to when they're getting a vaccine. So the material in those vaccines is so minuscule, it's so small. There's no way you can get a soda can full of vaccines. I didn't even understand what that one was all about, that recent myth that I heard, because there's no way. And if you actually pay attention and see how small those little needles are and how minuscule amounts of medication is in there, there's no way that we could overwhelm an immune system compared to what this child is being exposed to when they walk out of the office. So that's one of the main myths or misconceptions that we're seeing a lot of now. But of course, other concerns, the big one that vaccines cause autism. I spent 20 years or more, and still to this day, combating that myth. Unfortunately, now we're starting to see reoccurrence of diseases that were literally eradicated in our country. Measles was literally eradicated a few years ago, nowhere in the country. Now we're having outbreaks because of this one unfortunate study that this one physician did, who was actually paid by a drug company to do the study. And he actually lost his license because of that study, because it was so erroneous. And so all that to say, we do know that there's concerns about that. And we work really hard to help combat with all the amount of highly researched studies that had to follow behind that. And when it comes to autism, I think a lot of it, well, I know a lot of the increase in the diagnosis is associated with our ability to actually diagnose effectively now. We have the tools to actually diagnose these children when we're seeing them at an earlier age and recognizing those signs instead of just kind of grouping them into one diagnosis like we used to back in the day. We're actually able to diagnose effectively and treat effectively now. So that's what I like to focus on with that myth, because, if I'm recognizing symptoms in the child who might not even have had the vaccines yet, that can happen. I want to make sure that we're addressing those concerns and reassuring our parent. And that's where that trust comes in, that you ask those questions. If you've heard these myths, you've heard this, make sure you ask and take the time to listen and make sure you're getting credible information from the sources on there. I've heard a lot of other ones too. I've heard folks, the vaccines are putting transmitters in us and tracking us and all kinds of stuff. So there's plenty of them. So always consider your source when you're consider
there are. And Dr. Google is not the best resource.
No.
But there are some credible sites online. That's why we encourage you to participate in our programs, or if you have questions too, we can always reach out, because we can tell you what the credible sites are. Yes. And right now there are a whole lot of sites out there that are just
right.
No. And so you want to be able to have the relationship with your child's doctor, with your doctor, that you can always reach out and you can ask your care providers what is the correct answer. What are the correct treatments? What do I do? What do I not do? What do I believe? What do I not believe?
That's right.
And so there's just so much going on.
A lot. Yes.
So we're going to just slightly switch a little bit and just talk about adult immunizations. Can you tell me which vaccines are important for adults to stay current on?
For adults, now we need our vaccines too now. The vaccines don't stop after you stop going to the pediatrician. I always tell my big kids that, as well as the adults that I come in contact with all day, every day. So for many adults, staying kind of up to date, definitely staying up to date with your seasonal ones, including your flu vaccine. We're starting to see COVID again. So making sure you address your COVID and your flu vaccine. We talked about the tetanus boosters a little bit, making sure you get your tetanus booster every 10 years, because adults can get whooping cough as well. Grandma can get whooping cough and unfortunately transfer it to that newborn. So the adults need to make sure they get their tetanus booster. Of course, shingles, also known as the same family as chickenpox. I always remind adults, like, if you had the chickenpox, you're at risk for getting the shingles, and those are not fun. So getting that shingles vaccine and also that pneumococcal vaccine are also very important for adults as well. So, and the simplest way, or the easiest way to kind of remember all this, is making sure you just have your yearly checkup with your physician to make sure you're up to date on the recommendations for age, your health conditions. Your physician's well of your health conditions and definitely can make the recommendations of what you need at this time for your age.
Wonderful. So if you have questions about which vaccinations that you need to update yourself, talk to your doctor.
Absolutely.
And what if you've relocated to this area and you don't have your old medical records and your new doctor know that they have not given you any of these updates? what do you recommend for that?
Definitely do not go because you don't know what your vaccine status is, right? Make sure you go because you won't have to start the whole thing over. I always remind people you're not going to have to start from the beginning if you're adult and you don't have your shot record, but you got them because you went to school, right? So one place I tell my younger adults to look, if they can't find their shot record or they don't know if they left it at mom's house or if they moved or don't know where it is. When you graduate from high school, they give you a diploma and they usually slip in your shot record because you need that shot record for school. They usually slip it in that envelope when you graduate. So always check there. Check your college records too. You need a vaccines probably when you register for college sometimes. So check with your schools that you've attended in the past. There are some registries and states throughout the country that have a state registry of vaccines. So you can contact your health department to see if they might have a copy of in the state registry of your vaccines. But one thing, same thing, don't not go to the doctor because you don't know what your shots are and you're scared of getting all these shots. But like I said, you won't have to start over. And they'll take into account your age, your health conditions, and what you do for a living to help you determine what your catch-up shot schedule would be if you can't find your vaccines.
Okay, wonderful. So, say what vaccines are recommended for adults with chronic conditions and community-facing jobs?
Very important question because a lot of times, adults as we get older, we develop some chronic conditions. So adults with any conditions like asthma, diabetes, kidney disease, heart disease, or even if a weakened immune system for many other type of disease, they'll be at much greater risk of serious complications from certain infections, right? So you want to prevent those complications as much as we can, and any type of exposures. So depending, like I said, on your age, your health conditions, whatever it may be, your medical history, your doctor may recommend, of course, your flu vaccine, your COVID vaccine, that's shingles, hepatitis, and pneumococcal or pneumonia vaccine. A lot of people call it the pneumonia vaccine. And people who work closely with the public, so your teachers, your healthcare providers, your caregivers, if you're a caregiver for an older adult or a younger child, anybody who has constant exposure, very important for you to keep up with your vaccine status too, because you're exposed to somebody who may not be able to get their vaccines at a certain time. So a good question to ask, like I've been saying, when you go to your checkups to your doctor every year, ask them, just based on my age and my current health conditions and what I do every day, which vaccines do I need at this time or at this appointment? And they'll be able to kind of help direct you on there.
Right. So if they don't know, again, just to recap, if they don't know that they've missed certain vaccines, that there is a way that they can find out. And if not, then the doctor will know what to do from there.
Yes, right. So like I said, don't
because it is like I said, as they're working with the public, they need to stay current.
They need to know what they do, or they might not need anything. There's also a way, if you don't know what your vaccine status is for certain vaccines, I know they can check your titers. So you can you can check your MMR titer, and if it's high, you don't have to worry about getting it. Or if it's too low, then they'll give you that booster. They can check hepatitis B titers the same way. So they can say, hey, your immunity level is fine. You don't have to get this booster, but you do have to get this one. So there are different ways where you can check your titers or check your levels, but certain vaccines to see if you actually need that booster, if it's something that's required for your job or, your health condition.
So you're providing us with a lot of wonderful information and important information that we need. It's valuable that we have discussions like this. And so we want to make sure that we talk about what are some recommendations during pregnancy and how do we protect the newborns?
I love this question because when you're vaccinating somebody who's pregnant, you're actually vaccinating two people. So you're providing protection for mom and the newborn that's becoming. So always, of course, if you're pregnant, speak with your obstetrician so they can help you decide which ones are best for you during your pregnancy. So the certain vaccines that are typically recommended for pregnant women are that tetanus booster, the one that helps prevent the whooping cough or pertussis. So tetanus is given during pregnancy because that helps protect the newborn babies from whooping cough in those very first vulnerable 3 weeks of life, where, like I said, a grandma or somebody might be coming to visit, might not know that they have it, and trying to kiss and hug on the baby, and unfortunately, baby would get it. So, getting the tetanus booster during pregnancy is recommended, as well as influenza, the flu vaccine for pregnant women, because pregnant women can get very sick with the flu. So in order to prevent that, a lot of the obstetricians are recommending flu vaccine during flu season, of course, on there. So, and like I said, it protects the baby because those antibodies mama has when she gets those vaccines, those antibodies can pass on to the baby before birth. So the baby comes already protected, has some level of protection against any of those diseases early on in those early weeks of life. You know, everybody wants to come and visit and look, see, as I said.
Well, now that you mentioned that everybody wants to come and visit, what are some things that parents need to know about staying up to date before they bring their babies home?
Absolutely. I kind of think about it like a circle of protection for the new baby. So because newborns are too young to receive some vaccines, of course. They can receive the hepatitis B vaccine as a newborn, but other than that, they have to wait till that 2-month checkup to start getting their regular scheduled vaccine. So there's a time period right there where we want to make sure those visitors, including the parents, so the parents, the grandparents, caregivers, anybody's going to be spending a lot of amount of time around the baby, they need to be making sure they review their vaccine record so we can help have that level of protection right when the baby comes home. And then once baby comes home, keeping those regular scheduled pediatric visits are very important, because we aren't just checking for weight gain and growth and stuff. We're also looking for developmental signs, making sure baby's developing well. If mama's breastfeeding or bottle feeding, making sure she's doing well as she's feeding the baby, and making sure they're both doing well and adjusting to this new life and new change, but also making sure that you can ask questions. That's the time when you really start developing that trust relationship with your parents. As you know, some of them, I always used to tell them, babies don't come home with a manual. We get more instructions when we buy a new car or buy a new TV. Babies don't come home with a whole manual. So it's important to ask questions when you don't know.
Yes.
Please ask it instead of going straight to Dr. Google or asking, asking your relatives, your mom and grandma. They got some good advice. I know a lot of folks don't like to hear about that, but those young parents, I do encourage them, ask your doctor, ask your pediatrician, just what their recommendations are.
A lot of times, new parents, we don't think about the fact that our babies are big, we just want the family to meet the baby, to love the baby, and we don't think about the fact that they could be dangerous to the baby. And so having that information is very important. And also it gives them an opportunity to explain to the parents or to the grandparents or whoever before they bring their baby home, these are some things that we need you to consider, and we're not being mean to you, or we're not trying to be avoidance or stuck up or anything like that. When we ask you these questions, we're just trying to protect the baby and mama at the time, because her immune system is under compromise at that time too. So we want to make sure.
Tell them all the time, you can blame it on me. Tell them the doctor said.
Good advice. Tell them that the doctor said
it. Yeah, so I don't mind at all.
Okay, we're going to switch just a little bit because, in Mississippi, we don't raise our children alone. Everybody gets involved: the schools, the daycare centers, the churches, the community groups, and we want to, and vaccines, when we talk about that, that's one of those things that we want everybody involved and engaged with. And so, before we get into those details, I do want to stop and acknowledge that we realize that every parent wants their child to be safe and they want to do right by their child. But schools and daycares have vaccine requirements that we've talked about, and sometimes it can feel so overwhelming to them. So let's take a moment to break down what families really need to know and how clinics and churches and community partners can make that process easier.
Absolutely. And so, as you mentioned, partnerships are very important. So when you're working with school systems and clinics and churches, it's important to make sure that there's as I call it, a line of connection between all of those resources, because we all want to be a resource for these parents and their children as they're preparing them to go into school and daycares and preschool, and making sure they have the support that they need. So when it comes to providing information, through school health fairs or community outreach services, any type of event that, number one, can provide information, number two, can connect parents and children to a resource they might not be aware of. There's a lot of kids, unfortunately, who don't have one doctor. They use the ER or urgent care as their primary care. And sometimes those records can get lost in translation as they move from clinic to clinic. So having collaboration and connection between those resources is going to be really important as we take care of children, and getting them their information that they need for school, to attend school and stay in school too.
Wonderful. Thank you. So we talked about it just a little bit, but I want to just kind of reemphasize is how do clinics help families catch up on missed vaccinations or get records?
Okay. Like we mentioned, if you're in a state that the child was born in and had been seeing a doctor in that state, there's usually a registry your new doctor can pull up or look up. In Tennessee, ours is called Tennis. It's the statewide registry for vaccines. Mississippi has one as well. I always forget the name of it though. They have their immunization registry. But one thing I do want to and of course, having your own paper vaccine record is always handy too. I guess I can have them on phones too. But at the hospital, you usually, after the baby's discharged, and if they did receive that first hepatitis B vaccine, they should give you a shot card or a shot record. Or they usually give you the piece of paper too. So carry that around with you at every visit you go to. Doesn't necessarily have to be a checkup visit. It can be urgent care, the ER. Always have that vaccine card ready for you with your child when they're going to any type of hospital or clinic facility. But one thing I always emphasize again for kids, if you've already started a vaccine schedule and you have a record of it, but you're delayed or you missed some shots or you didn't go for that appointment because of whatever circumstance, they behind on shots, you don't have to start the entire thing over. Your doctor will help you start what we call a catch-up schedule, which basically they'll see when your last vaccine was for whatever, like if you got your DTaP, your tetanus shots 3 months, 6 months ago, they'll look at the catch-up schedule to see how far apart spaced that dose needs to be from the next dose, right? So you don't have to start all the way over from number one. You're going to start from wherever your next one is, just making sure it's spaced. So they'll literally help you develop a catch-up schedule and get you right back on track so you're on time. So the goal is always making sure the child is protected, so don't worry about it because life happens, stuff happens. You move, your insurance changes, stuff happens. So they'll help you develop a catch-up schedule.
As you say, things happen, and going back to our previous conversation, just a little bit off script here. No, because it brought to mind when we talk about measles and how it's on the rise again. And a lot of people we think about it in terms of children. We don't realize how dangerous measles can be, especially to adolescent males and young males.
Absolutely.
And so I just wanted to throw that out there and let you address that just briefly, so that because there are people listening and they may not have thought about that fact. So.
Absolutely. So when I was looking trying to do a little bit of research here for this program, Mississippi doesn't have any as of today right now, but of course, good old Tennessee, we literally have some documented cases of measles a lot. And I'll say this because when I was in practice, a little bit before I retired in 24, we were having smaller outbreaks in Tennessee, but they just weren't being broadcasted, right? Anytime that there's a case of measles confirmed, they have to do what they call 21-day tracking. So they have to find everybody who was exposed to this one person. So that's why you'll see on the news, if you were at such and such a restaurant on this day, contact the health department, because you have to be isolated for 21 days because that's how long the symptoms can take before they develop. And a lot of what we're seeing now is a lot of physicians and providers through training haven't seen measles in person because it was eradicated, right? So we read about it. We hear about the complications of measles, which are devastating, including hearing loss, brain damage, reproductive damage. So there's a lot of complications and consequences from measles. And so when we're starting to see a rise in the number of cases, or basically we're basically going to see an epidemic of measles happening because of the decrease in the amount of vaccination levels. We have to start preparing doctors, honestly, to be able to recognize those signs and symptoms of measles, because of course, a reportable disease. We have to let the health department know. They have to do all their tracking to try to find who all was exposed. One case here in Memphis a few years ago, a baby was out from out of town, came in to visit whoever exposed the whole family. The parents literally took the baby to a clinic here in Memphis where they got diagnosed. And so everybody was in that waiting room had to get quarantined for 21 days. And the office had to shut down. So the doctors were not happy either. But so it's very, very serious when we hear about those levels of measles increasing throughout any community, because there are devastating complications. And it's not just in children. Adults can get measles too, which is why it's important to know what your vaccination status is, because having one is better than none. Like I said, they can check your levels. You can check your MMR titers to see what your protection status is. If you just don't want to get the shot, but you want to know what your status is, you can have them check a titer. But it's very important when we're starting to see a rise in those vaccine preventable diseases, including whooping cough too. So,
and when we're talking about the fact that they can get access to these shots, can you tell us where Mississippi families can find low cost or free vaccines?
Absolutely. So always start with your health department. And if you have your local health department on, also community clinics too. You can find, if you're not sure if your insurance status or whatever, your health departments will definitely give you your vaccines for free and give you that shot record, so you'll be able to register for school as well. I always tell people to call if they're not sure. You can call a clinic to ask, and they'll just get information. My child is behind on vaccines or needs vaccines. We don't have insurance at this time, or we do. We have this insurance, because they're going to ask. They'll let you know. Schedule that appointment right then and there. Come on in, or check out this facility that we know will see and provide free vaccines that are needed and required for school.
Wonderful. Thank you so very much for that information, because we do know that, unfortunately,
yes,
a lot of people in Mississippi and Tennessee, in the country, don't have access to health care because they don't have the insurance, and it's getting worse. And so it's important that we provide them, again, with resources, knowledge about resources that will be able to help their families. And so we want our babies, we want everybody to stay healthy. Absolutely. And the health department is always a good place to start first if you don't have access to your own regular physician or provider. And trust is so important. And we mentioned that because respect matters. And so absolutely, how can we build trust between the patient and the provider?
And like we mentioned earlier, the first thing is to listen and to show respect, right? In order to have good, meaningful conversations regarding any health care question you may have, you want to be able to trust the person you're asking your question to, right? You want to make sure that they understand where you're coming from, and you want to understand what they're coming from when they make their recommendations. So listening and being respectful, not going in telling somebody you shouldn't feel that way. Now, that's not right. That's not going to help increase the trust level and that respect level in a physician and patient relationship. So, and it's not built over one conversation. It's built over time, right? And making sure you're being honest and consistent and respectful is going to encourage those questions that we need y'all to ask, because, we know what you're coming in for as an appointment, right? We'll see it on our schedule coming in for this, that, and the other. But if there's other things going on that you haven't told us about, the only way we're going to know about it is if you ask us about it. And that's the only way we can help you address or deal with that issue. So if you got questions about vaccines, or, what is this for? Why are you giving this? Don't hesitate to ask. And don't hesitate to slow down and tell your doctor to slow down and say, hey, I need you to answer this question about whatever. building that trust and level of respect is going to be the foundation of getting good, adequate care.
Wonderful. Thank you so much. And
Mhm.
finally, we've covered a lot. You provided a lot of wonderful information. And there are other questions that I could still ask, but we are looking at the time. And so I did want to ask you, is there any one thing you wish every patient understood about vaccines? And what upcoming vaccines or boosters should families plan for this year?
Well, as far as planning for this year, like I said, making sure you're ready for school. You have all of your school vaccines and daycare preschool vaccines. So going over your shot record with your doctor, making sure everybody's up to date. Planning for the flu season. I know it's 300 degrees outside right now, but flu season usually starts coming around. Kids are back in school now. They're what I call marinating. They're all together back again in those closed spaces. So that's usually when we start seeing our viruses coming up and showing up. So planning for that flu vaccine when those become available, and COVID vaccine. Actually, we're seeing COVID now. Um, One of my coworkers has actually had, and we know it's still there, but it's hard to remember because a lot of people try to put it out of their mind. But it's still here. It's a seasonal virus as well. So planning for those, definitely keeping those on your radar. But as far as vaccination, I just want to remind people that vaccination is about prevention, right? We want to prevent these deadly diseases. So I would much rather prevent a child from becoming seriously ill than having to treat a child in the hospital or the ICU or watching those devastating complications for a disease that we could have prevented. So I always remind, we're not just giving to just be giving these vaccines. We're trying to prevent and save and protect everybody from the devastating consequences of those vaccines, of those diseases that we had eradicated and that we're continuing to work on. So vaccination is prevention is my last word.
Thank you so much, Dr. Bess Jones.
Absolutely.
You provided us again with a lot of wonderful information, and we are so glad that you took the time to come, because we know that every year it brings new health trends and sometimes outbreaks that you mentioned, and sometimes updated recommendations. And a lot of parents don't have time necessarily to sit down and follow them like we do, because we're concerned about it, and we have to provide that information. So we have to stay current about what's going on so that we can help people. So we wanted to make sure that the Mississippi families get clear information, because they deserve clear and timely information. And so again, thanks so very much for you being, you being willing to be here with that critical information. So it's time now that we open up our mics to ask our questions or put our questions in the chat so that if you're on some social media other than Zoom, please put your questions in the chat, and Mr. Robinson will ask those questions for you. If you're on Zoom, you can open up and ask the questions. But also, I wanted to just remind you again that this webinar is very important. So share it with your family and your friends, and it will be posted later, so you can actually sit down with them and talk to them. And if they have any questions or concerns, maybe you can answer from today's webinar information that you've been provided, or you can also call us. So are there any questions that you see in the chat, Mr. Robinson, Duke?
No, ma'am. If anyone on Zoom has any questions, they can raise their hand and we'll unmute their mics. But I don't see any questions on social media at this time.
Okay. So I guess they're saying you did a very thorough job.
Oh, well, thank you very much.
I don't have any questions or concerns. And I know that
a lot.
Here's one. She said no. Sister Boga says no questions for Dr. Bess. You explained it well, and she got all kind of exclamation points behind it. So Dr. Tamara Rose says great job.
Oh, thank y'all so much. Yes. I really appreciate it. This was so fun. I love doing any type of education to help get the word out. So just call me if you need me.
All right. Okay. So I guess now it's just time for some friendly reminders. Ask Mary and Pat Zoom webinar will be 6 p.m. Monday, August the 31st. And remember that webinar is about answering your questions about Medicaid, Medicare, CHIP. So if you have any questions or concerns about that, VA questions, you can tune in August 31st at 6 p.m. and to ask Mary and Pat and get your questions answered. And if you have a question that they have not encountered before, guess what? They're going to go find that answer for you and bring it back. So you just if you are concerned about something, just reach out and listen. And then Let's Talk Real Estate with Area Mays will be 11 a.m. Thursday, August the 27th. And finally, please remember that the next third Wednesday Parent Resource Chat will be held Wednesday, September the 16th. And in support of Health Services, our focus will be on healthy aging and Senior Recognition Sunday. So I want you to join us and encourage your friends and family to join us so that they can share in getting this wonderful information that they need. And if you have any questions or concerns, or you want to just learn more about us, you can go to our website, www.healthytogetherms.org. And once again, we want to acknowledge our Executive Director, Dr. Michael O. Minor, and our Program Director, Lottie Minor. This has been a production of Oak Hill Regional Community Development Corporation, empowering parents and strengthening families in the Mid-South and across the state of Mississippi. Thank you. And if you are on anything other than Zoom, you may sign off now, and we want to wish you a healthy, blessed day. And thank you again for joining us. If you're on Zoom, just stick around for a few minutes while we sign off. And if those of you that may have been too shy to ask questions while we were broadcasting, you can ask those questions